Hi, this is Carla Wills Brandon, author of Learning to Say No, Is It Love or Is It Sex? Why Relationships Don't Work, and Heavenly Hugs, which will be due for release in November, and a host of other titles. You can either go to Amazon.com or just Google me and you'll find out more information than you really want to know about me. I was going to be talking to the mental health professional with regard to the departing vision, but I decided not to do that. I'm going to go back and I'm going to address the medical community. Recently, a cousin of mine passed away. About a week ago, he started having departing visions. In response to his departing visions, his medical team had talked about inducing a coma. That was their response to him having departing visions. His wife had passed away about 11 months previous to him. This is not an uncommon occurrence. Oftentimes, couples will pass within 1 to 5 years of one another. Not always, but it is a common occurrence. Well, when he started having his departing visions, he started calling out to his wife. The family, they know what it is I do, they know what it is I research, and so when he did start calling out to his wife, they knew that chances were that he was going to be crossing over soon. Well, I don't know if this cousin got wind of the fact that they're going to induce a coma, but he suddenly rallied. He rallied for about a week, tied up some loose ends, and then he made his way to the other side and joined his beloved wife. People within the medical community, what you need to understand is that the departing vision is nothing to be frightened of. You don't need to over-medicate for it. It's not a hallucination. It is not a dying brain. It is actually, for the most part, a very comforting experience for the individual who is getting ready to cross. It emotionally assists them in making peace with death and dying. It frees them up to be able to talk to their loved ones about death and dying. In many instances, those at the bedside experience it assists them in their grieving process. So there is no need for you to medicate this experience. Once in a blue moon, you will have somebody who will be a bit upset when they start seeing loved ones or invisible people in their hospital room or at their bedside. But with time, even these individuals find some peace too. Also, your patients, it's consistent. Look at the research. Just Google deathbed visions. Get some information for yourself. They are always consistently visited by deceased relatives and loved ones. It's not the guy across the street they play bridge with or the person who checks out their groceries at the grocery store. It's somebody that they know. And what this does for them is it assists them. It can assist them. They can be a very, very difficult patient of yours. If they have a departing vision, oftentimes they will calm down and they will be easier to work with and they will be more at peace themselves. So, no, you don't need to induce comas or prescribe, over medicate. Yes, pain management is, yeah, I'm all for pain management. You guys do a great job doing that. But if you have never experienced a departing vision and then you watch one of your patients have a departing vision and it scares you, get some information. If you are one of those folks who has seen the departing vision over and over and over again, please educate your colleagues. Let them know that the departing vision is a really, really okay, healthy thing for the dying to experience. This is Carla Wills Brandon reminding you that physical death isn't the end. And gang, you don't have to be afraid of the departing vision. It will help you. If you are grieving the loss of a loved one and your loved one has experienced a departing vision, it will actually help you too. Take care and have a good evening.